Hi, I'm Paul Conrad, physiotherapist in the West Hill Physio Clinic, and today's video we're going to be talking about squats. The reason I want to talk about squats is we get a lot of patients coming to the clinic who have been doing some form of squat either at the gym or they're partaking in some sort of exercise class where they've done squats, and they start to get some symptoms off the background of those. And quite typically we get patients who come in with some sort of knee pain, or other people have been trying to progress their squats on and start using barbell across their back and increasing the load and have quite a poor squat technique, which has then strained their back. So I thought it'd be a good idea just to kind of go through what I would look for in a reasonable squat technique, which obviously keeps you safe. Because it really is a good exercise. It's what we call a compound movement, so we're using multiple joints, multiple muscles. It's actually quite a functional exercise to do, so even it's pretty much suitable for most age groups. Typically people will do some form of squat in their day-to-day life, just getting in and out of a car, getting out of a chair, etc. That is a squat. So the better we condition our bodies to do these things, the better you'll be with everyday tasks such as climbing stairs, getting off the floor, crouching down, those kind of things. And it is an exercise that as a physiotherapist, or we as physiotherapists, will traditionally give people quite commonly just because it's such a good strengthening exercise. But we want to make sure that you're doing it, and if you're doing it properly and doing it safely so you're getting the most out of it. So without further ado, this is how I would do a squat. So I'll show you from a side position. What we want to be doing is, the reason we're giving out, so it's a great exercise to work the quadricep muscles and the glute muscles. So we want to make sure that our backs remain quite straight, we don't round our back off too much, and we try to keep our weight backwards. So this is kind of what I want to look for in the first instance, but if you actually struggle to do this, I'm going to give you some strategies that you can do to improve the mobility through certain parts of your body to allow you to start squatting with correct form and technique. Okay, so when we're standing to the side, or when I'm looking at a patient from the side, what we want to look at is feet shoulder width apart. And the most important thing when you do a squat is actually sitting back into the squat. So if I show you how it would be done incorrectly, this is kind of what we see if I assess someone doing a squat and if they've had some form of injury in the past. Just they might come too far forwards here. So in this position here, all the weight is going forwards. We've got our trunk position too far forwards here, and all the weight is going through the front of the knee. So this might be a typical reason why somebody might get knee pain. So what I'm trying to do is encourage our patients to start sitting back into the squat, and this will obviously improve hip mobility as well, so it's good for that. So this is how we would want to see it, so I can sit back into squat, trying to keep my back here relatively straight. You should be able to move and wiggle your toes around while you're in this position. Keep your face forwards. I tend to put my arms in this position here to kind of counterbalance myself. And when you're holding this squat position, you really should feel it really working in there, or working in the quads here. You shouldn't feel any knee pain in the actual knee here. As we come up, we want to drive through the hips and drive up through the heels of our feet, and we'll push straight back up again. So I'll just show you once more. I want to sit back, so you see I'm sitting back into the squat here. Okay, and then we're going to push straight back up again. Again, incorrectly would be this position here, you can see all my weight's forward. So I use the analogy of sometimes if you had a plumb line, say from like over your head or from your sternum dropping down, that plumb line should sit between your feet when you're going into the squat. So if I'm coming forwards here, the plumb line would be outside of my feet. But if you're sitting down here, you can see that be dropping between the feet, which is where we want to be. So the reasons why some people can't do a squat is because of poor mobility in the hip joints. It might be a bit stiff in the hips, might have some stiffness in the ankles, or sometimes their thoracic spines, they get quite tight. So you may find that in people who sit in front of their desk quite often, so they get kind of quite a rounded posture, and so they lose some mobility in those areas, and that's why the body has to compensate when they go to do this type of exercise. So if you're one of those people, you find that you're struggling to keep sitting back into the hips, one strategy you could try to adopt to start with is go for what we call sumo squat. So it's just a much wider stance, and basically do the same again, so sitting down into that squat position and pushing back up again. So some people find that much more, much easier to do than having a more sort of shoulder width sort of stance. But again, if you find yourself when you're trying to sit back, you're just losing your balance and you're falling backwards and you really can't get your weight over your heels, this is the next strategy I'll get people to try. and I call this a door assisted squat. So even those people who have some sort of knee pain, we can still get them doing this type of squat because it doesn't actually put any pressure on the knees. So I'll just show you, if you can get a door at home that's quite robust. Stand opposite the door, use the door handles, getting quite close, getting feet sort of shoulder width apart. And again, what we're going to do is we're going to sit back into our heels, sit back into the hips, and sit down here. Keep the feet shoulder width apart, don't let them come together. And again, as we're coming back up again, keep the elbows extended, so nice straight arms, and then we're going to push up through the heels of our feet. Again, people tend to do this wrong. They tend to sort of sit back into this way, so we lose that trunk position more afterwards. Or they tend to bend their arms as they go down, which again is putting weight through the front of the knee. Or when they come back up again, they tend to pull up with the arms. So we don't want to be doing any of those things. So that's one strategy that we get people to do. I said the idea of that exercise is it improves ankle mobility and gives you more flexibility in the hips so that you can hopefully do an unassisted squat. And if you're kind of doing quite well with that, now I to try and get a bit more of thoracic extension in here so we keep your trunk nice and straight, is to actually start doing a squat against the wall with your palms facing the wall. That actually pushes your arms up and gets your thoracic spine nice and straight. So facing the wall, facing the door, whatever you like, arms facing the door, and as you sit down into the squat, again, keep your arms and the palms of your hands against the door. That keeps us in that nice position, and then we push back up again. So as you do that, you'll kind of feel it working in this area here, and you'll find that will give you a bit more mobility. So it's really important that you get the squat right before you say you try and progress them with your exercises. You certainly don't want to be doing any some sort of front-loaded or back-loaded squats with barbells, or trying to increase load until you can squat safely. That way it will keep you nice and safe. And also, just using the squat as a normal strengthening exercise can help improve your balance, improve your mobility, improve your strength. Just do daily tasks like walking up hills, walking upstairs, getting off the floor. That's why we give it out, and hopefully you'll find that will help you. So do check out our other YouTube videos. We're on Injury Fix for free. Check out our websites, www.westillphysio.co.uk, and also check us out on Facebook as well. Don't forget to share and like, and we look forward to seeing you in the next video.